And now we would like to welcome up Elder Rusty, but in this case, Dr. Rusty, with some information.
That's good, right there. Well, shalom, everybody. All right. We are going to be talking about the coronavirus. Okay, and there's a really good reason to talk about this because there has been a fair amount of early information that was accurate for typical coronaviruses, but completely off base for the one that we're dealing with. So I'm going to take my mask off, but I want everybody to see what I've got on. Clear glasses, something to protect my respiratory system from taking things in. If I'm touching stuff and shaking hands, which you should not be doing, okay, you will not be picking this up on your hands. And it's really easy to strip these off and throw them away. When you go out shopping, as you're picking up cans that other people may have handled, places that other people may have coughed and sneezed, this will protect you. And we'll talk about how to implement that at home as well. So for the moment, I'm going to take those off. These do come in different sizes. These are just food handling. They will protect you from the coronavirus just fine. They don't have to be super tight so that you get all sweaty, and they're a pain in the neck. There's no doubt about it that all this stuff is a pain in the neck. All right, so let's put some stuff out here. We've got a lot to talk about, and not a super amount of time to do so. Head covering to make sure that you're not picking stuff up on your head. And we're going to talk about two different population groups, both of which we have in our congregation. Those that are healthy and fairly young, and those that are elderly who are at high risk. Hi, Pastor Denny. Yep, absolutely. All right, give me just a second. And that may seem like a lot to do for something that a lot of people have been saying is really much to do about nothing. But they've been saying it's much to do about nothing because the information that they had was incomplete. So let's talk about this. On your left-hand side is this novel coronavirus, and that is one of the names for it. Novel means new and different, which means that it does not act the way the regular coronaviruses do. Everybody's heard of the common cold? The rhinovirus and the coronavirus are typically the two primary causes for the common cold. Okay? This is not the common cold. This is anything but. This is an artist rendition using information that they gather from electron microscopy that shows us what the surface looks like. These red things that are sticking out are these pieces that are sticking out there. And just so that everybody's aware, I'm a doctor of veterinary medicine. That actually becomes a little more helpful than less helpful in these circumstances because we get a great deal more training on how to deal with pathogens that are contagious because we deal with that quite a bit day in and day out. Human doctors get very little of this. So the coronavirus got its name because when they were able to look at these things with electron microscopy, you get this halo effect around it, both in these things that are sticking out, but also in this black area, right? Let me show you why they made that association. This is a picture of the sun where they blacked out the disk and looked at the corona, which is where the virus gets its name, means crown, that surrounds the sun. And you can see the similarities right away why they would do that. Okay, this is what it looks like when a coronavirus is infecting a cell. Notice the size difference. 5 microns. None of us run around and talk about microns. This is actually not 5, I'm sorry, this is a half a micron. This is a little bit of idea. These little tiny hairs that you have on your body that are super, super thin, the very thinnest one that they can identify is 17 microns thick. Hair on your head typically is in the neighborhood of 90 to 181 microns. Okay. Pollen, 17 to 30 microns. A liver cell is about 20 microns across if it's healthy. And an E. coli bacteria is 1.8 microns across, but it has a length that looks like a rod, and it's 7 microns long. So these range between 0.68, about 0.7 and 0.36 microns, okay? They're not exactly spherical, although often they're depicted that way, and they can come in various sizes and shapes. But this is the size frame that we have to deal with. And that means that what works for dust and pollen may not work for this virus. And so you probably remember earlier that they said these N95 and N99 and N100 masks, stop buying them because they're not going to help you. That actually wasn't accurate, because if the rest of their sentence was, and besides, we need to keep them for our healthcare providers so we can protect them. Right? If they're not going to protect the healthcare advisors, they're not going to protect us, but they are protective. And size-wise, these N95s will filter out 97.7% of everything that is 0.3 microns and bigger. Okay, well, that helps us because we know how big the virus is. So it would be helpful. The P99 filters out 99%. The P100s, it's 99.7%. And I'm sorry, you may see these as Ns, you may see them as Ps. The Ps are ones that also filter out oils and other substances in addition to particles that are of this size. All right, so again, that's what it looks like in the computer generated. And you notice that they've been calling this by a bunch of different names. One of them is novel, and we see this in this designator here with this little n in front of the CO. CO means corona, V is virus. 2019 was when it was identified. That's when it first showed up. It's also called the COVID-19, 19 designating year 19 of the 2000s. Again, coronavirus. It's now getting the designators as SARS-CoV-2 because a number of years ago we had our first SARS virus that was a coronavirus that came out of cats, possibly also through bats. And the SARS is just an acronym that means severe acute respiratory syndrome, which means that you go into a pneumonia where your lungs fill up with fluid, and that usually ends your life unless you have life-saving things like ventilators. You have to go on a ventilator when you get to this point or you won't survive. All right, so why is it novel? Because this virus does not behave like other coronaviruses. Again, the common cold that we all experience is what coronaviruses are. They're in that family. This one behaves very differently from that. So let's look at what that means. Every virus and bacteria, any kind of pathogen that's trying to get into your body is going to have a point at which you get exposed. That may be because you shook somebody's hand. It may be because you put your hand on something that was contaminated and then you rubbed your eyes, rubbed your nose, ate a sandwich. Hygiene becomes exceedingly important in this. And after your exposure, the virus is in and it's starting to do its thing, but it hasn't made itself known yet. And that's your incubation period. How long do you go before you start developing symptoms? And when do you become contagious? That becomes really important. Most of the time, the replication process is such that you don't become contagious until the end, until you actually break with symptoms, just a little bit before that. And anybody who has kids knows that the rule is, if your child has a fever, and usually we're talking about the flu, another virus, different category, you needed to wait 24 hours after the fever ended before they could return back to school. Why? Because inside that 24-hour period, they are still shedding the virus. All right, so let's see what that looks like. So you have a 2 to 4 day typical incubation period for most coronaviruses. Okay, you have a few minutes to an hour before you start feeling sick that you're actually shedding virus, and you don't know it yet. And that's a very tiny amount of time. You're sick 5 to 7 days. Fever is rare for the coronaviruses. It doesn't normally cause fevers, and that's one of the differentiations between this novel virus and the other ones. And again, if you get outside 24 hours after the majority of your symptoms have resolved, particularly if you did have a fever, then at that point you're deemed not to be contagious anymore. Now, cough, because that's a respiratory issue. You can be coughing for up to 3 weeks and not be contagious after about 24 hours after the rest of your symptoms, runny nose, scratchy, itchy throat, sneezing. Once that stuff resolves, you get about 24 hours that you need to wait. And then you're not contagious anymore, even though you may be coughing. All right, here's a really unsettling piece of information. And we have no idea at this point what this is going to mean for the novel coronaviruses. When you get sick with a coronavirus and you get a cold, you will be sick for your 5 to 7 days. You will recover. The vast majority of people do not develop pneumonias or respiratory issues unless they have other things, and that still is exceedingly rare. But then the clock starts ticking. Your immune system has no way to keep track of this sufficiently, and so in 4 months, you can get the exact same virus again. Okay, when did this novel coronavirus start? Late December. Are we even through 4 months yet? We have no idea whether the novel coronavirus is going to fit this category or not. All right, so let's talk about the novel coronavirus. The early information that the CDC put out was all predicated on, oh, it's a coronavirus, so that means it does this. And that's what they said. And if you knew what you were looking for, in their website, they made it clear that what they were talking about was not the virus that they were dealing with, but typical coronaviruses. And their recommendations were based on typical coronaviruses. This is not a typical coronavirus. All right, so we have our exposure, we have some sort of incubation period, and you can be contagious for up to 14 days before you develop symptoms, which means that you can be walking around, doing your thing, breathing out virus, contaminating people either by touching things and breathing on things, and never know that you were sick until you break with the fever and the rest of the symptoms. And then you know. Time frame wise, you're sick for somewhere between 7 and 14 days, and we break this into 2 populations, 3 actually. Really young kids, they have no idea why, but they don't get it. That's good news. Usually, when we're talking about this typical coronaviruses, daycare, schools are the big areas of transmission. The young children do not get this novel coronavirus so far. Other people who get it that are fairly healthy tend to get mild symptoms. There are exceptions to that, because there are people who develop pneumonia, even amongst the younger, healthier. But when we look at elderly people, and anybody who has cardiovascular disease, that has high blood pressure, that has diabetes, diagnosed or undiagnosed, which would include most of America, has respiratory illness of other sorts, or has a sort of inflammatory condition, they are at high risk of death if they develop this virus. Okay, so avoidance is going to be really important. And again, we have no idea. We are not even 4 months into this, and we just don't know where this is going to go. Whether this will be something that you recover from on the beginning of March, and by the time end of July comes about, you get exposed again and you're down with it again. We have no idea, okay? And so, only thing that we know of that stops transmission is keeping people from mixing, because it's airborne for the most part, and fomite transmission. All right, anybody have any questions about this? Yes?
Rusty, what about pets and stuff? I have cats and dogs.
I'll talk about that later. The short answer to that is there are confirmed cases of asymptomatic dogs that have it, that potentially could pass it on. And so one of the recommendations is don't be sleeping with your pets, segregate yourself from your pets. I mean, some of these things are going to be harder to do for many people than it is for the people. A lot of us don't particularly care for others.
You're right about that. My question is, how do they know it's only 4 months and not maybe 5 months or 3 months?
No, after 4 months.
Okay, after.
It takes 4 months before your body is able to pick it up again.
It's 4 months and not 5 months.
Because we have dealt with the common cold. Well, you can get it from 4 months on, right? It's not that at 4 months you're either going to get it again or you don't. After 4 months, your immune system has no ability to recognize it, and you're going to have, it's like a brand new infection for you. Oh, hi, how you doing? Nice to see you again. Okay, and that will continue. You just, after 4 months, you have no immunity to it. Okay, so and we just don't know. The last question for right now. Yes, Keith?
How long has rhinovirus and coronavirus been around, and how long will this one be around?
It depends on your answer to the new Earth theory. Viruses have been around as long as there have been organisms. And those viruses, they can find them as far back as in, they found them in the particles in the mummified Egyptians and some other folks. They can identify those in electron microscopy. These things have been around for a long, long time. We're going to hold questions right now. We'll come back to it here. I want to make sure that we get through our material. All right. Here's the other kicker. Okay, after you stop having symptoms, there are individuals who are asymptomatic who continue to have virus that they are shedding for up to 37 days. Okay, again, this is not a normal coronavirus. Okay, now you start to understand why they are, as they have come to understand what this really means, why they are recommending some of these what seem to be very draconian sorts of thing. Don't go, I mean, they canceled pretty much everything in New York City at this point or postponed it. All right. So, what are the symptoms of this novel corona break? One of the primary features that's different from what we typically experience with the coronavirus is this has fever. And it's not an insignificant fever. It tends to be, 100.3, maybe a little bit higher. Okay? And so, if you're having fever, it's possible that you may have the coronavirus. Cough, and notice that the other one is shortness of breath, right? That's the struggle to get air in and out of your lungs, okay? You just feel like, I'm just really working hard at breathing, okay? Those are some of the primary symptoms. And again, it could be up to 14 days after exposure that you develop symptoms. And people have tested positive within that time frame, but been asymptomatic, but they clearly can get the virus. All right, so recognize that this isn't an upper airway. This isn't like the typical coronavirus where it's nasal passages, sinuses, the first one or two branchings of the respiratory tract. This is the deeper lung tissue, and that is part of what makes it a big deal. See, we all did this a few years ago, and we've all abandoned it, and we really need to return to it. Exceedingly important, okay? Doing this and coughing into the back of my elbow keeps me from showering the back row with potential virus particles. Okay, and we'll talk a little bit more about this as well. So there's another name this virus is known by, the Wuhan virus, because it started in Wuhan, China, and it quickly spread to the rest of China. The only thing that has been shown to stop the transmission and to stop the spread of this virus is to stop mixing with other people. That's tough. That means workplaces are shutting down, schools are shutting down. Grand Canyon University, Arizona State, all have basically sent everybody home. Most of the universities are now doing stuff via online rather than having them come back to school. Why? Because of how this is transmitted, and it is a big deal. There is, this virus has its original origin in bats and or snakes. They have components of both genetics in this virus. And the claim is that since the snakes eat the bats, that's maybe how the two got together. But it is not a typical virus. Okay, people have probably seen these pictures. This is a containment unit. They are moving somebody who has the illness, and they literally have put them into a containment unit, as is this. And these guys at this point have full personal protection equipment on. These are the pictures that were coming out of China when they could sneak them out, and also the pictures of the crematoriums. This is a patient being treated. Surgical gloves. In 95 or 99 masks, I can't tell from here because they look very similar, but it's probably a 95. Full covering of the head and body, right? Eye protection on everybody. And notice what this guy has on. What does that look like? He's actually got two on. He's got one on his forehead too. It's what we typically think of as a surgical mask. Here's another picture of these guys. Right? They literally have isolated that ward for the air handling so that the air handling there only goes through there and doesn't connect to the rest of the building. And they were going through decontaminations to come in and out of those areas. All right. It's novel because it does not act like the common cold, and it has some very significant potential to disrupt and kill people, and also to disrupt the economy, which is likely coming as well. So you may hear it spoken of as the 2019-nCoV. You may hear it talked about as COVID-19, as SARS-CoV-2, or the Wuhan virus. All of those are names for the exact same thing. It's just how they're differentiating them. Now that they know that it's associated with the severe acute respiratory syndrome, that's where it gets the SARS designation, because that's how it's killing people. But it is novel. It does not act as they expect it to. So the question becomes, okay, how do you protect yourself? Okay, we laugh at this guy, but let me tell you right now, he's smarter than you think he is. And I am not being silly about that. When you do not have the implementations that you need, you can't get a hold of these. Healthcare providers can't get a hold of these because they've been just snatched up. Think of the toilet paper, right? Same sort of issue. If you can't get a hold of those, and by the way, this is a N99 mask because it's got this little exit here. He's protecting his head. Can't see it, but there's a screw top on top of that. And notice that he's covered like I am, right? It's all zipped up so that he's minimizing his exposure. Anything he comes in contact with, he can do something about it. All right, notice that these guys, back to your full hazard suits, these little slippers that they put on the feet so that they can lift off and then proceed to walk and not have their feet take that virus with them. The guy's got his surgical mask on, and we'll talk about the differences between these. So what gives me qualifications to stand up here and talk to you guys about this? Training that the doctors get, that human physicians get, is very meager for infectious diseases. On the animal side of things, we deal with some really, really nasty stuff. This is a very common experience for all of us going through vet school and for all of us who graduate and start working. We do this when we're dealing with things like parvovirus, or in horses, respiratory viruses, or brucellosis. And if you get outside of the United States and start looking at some of the horrible stuff that's in Africa, there's a heck of a lot of this that's going on. We deal day in and day out with how to identify where the transmission sources occur and how to prevent that. We have 7 billion people on the planet, and we have intensive animal handling, intensive agriculture, and the only things that make that possible are being really smart to prevent transmission and biosecurity. This is in a chicken coop. Again, notice these guys are fully gowned up to protect themselves. Why? Because if they leave this facility and go someplace else to the next client they're going to see and take it with them, they may then contaminate another flock that's going to have to be killed. All right, so animal disease response training is something that we go through quite a bit. And then again, day in and day out with what we do with our jobs, unfortunately, we have to deal with it. Thankfully, we don't do this ever here in the United States unless you're working with the government on things that will kill people and kill animals. Foot and mouth disease and Ebola and stuff like that require that. Likewise, when you're talking about those sorts of things, these level A and level B. Level C, the respirator may not look like that, it may look like, okay? And then just day in and day out, if you're working on a farm, you may see folks that look like that. And again, I graduated from Purdue University, and whether you talk to myself or talk to my wife, Amy, also a veterinarian, both of us do this kind of stuff day in and day out when we deal with parvo, because it's highly contagious and highly lethal. All right, so biosecurity is really what we're going to talk about today. And the question is not how to keep the farm safe, but how to keep the fam safe. And that's going to be really important because what we do day in and day out and whether or not we take precautions will make a difference as to whether or not our loved ones stay safe and whether we may get sick. All right, so let's talk a little bit about what that means. This is a list, and I know the print is really small, but you have E. coli, you have the African swine fever, you have a whole bunch of other slew of various viruses and bacteria that are highly contagious and cause disease and death in animals, and many of these are zoonotic, which means that when the animal gets it, if I get it from the animal, I'm going to develop symptoms of that and die. Okay? So we deal with this stuff. This is a typical picture from how we deal with our parvo patients. This dog has the parvovirus, and notice these guys are just completely covered over, and she's covered her legs because she's sitting in the kennel with that dog in order to protect the other parts of herself so that she's not getting contamination that she then carries elsewhere. Right? And each patient has its own gown set that we use for them, and we're changing out those things frequently. Okay? This is what it might look like on a swine farm where they're going through and doing decontamination because either E. coli or a virus has gotten in. So these are things that we do quite a bit. And again, I will just tell you, as funny as this guy looks, he's smarter than you think because he truly is protecting himself and doing the things that he needs to do. So let's talk about how these viruses are transmitted. You have basically two routes. One is close contact that includes airborne. The person who's infected is breathing, and they're breathing out virus. And if you're close enough to them, within 6 feet, you will get it directly from them. And there has been some new information that has come out that we'll talk about in a second. And the other way is by fomite transmission. Now, some viruses get pushed out into the air, and they don't die very quickly, and so they can hang in the air because they're small, which the coronavirus is, and if you walk into the room where that person has been and you breathe the air, you may be breathing in virus particles with your air that you're taking in. They may be gone. Okay. That's not true for the typical coronavirus, but the novel coronavirus, they are finding hangs in the air and is still viable for 3 hours. Okay? They told people not to worry about fomite transmission, picking it up off of surfaces, because the typical coronavirus is in less than 15 minutes in these lights, it's dead. However, this is not typical. 42 hours, which means that you can go into some place that somebody's long gone and pick that virus up, and if you're not careful, you can be passing it on. Handshake? No? Okay. Just checking. I want to see everybody's paying attention. So these things become important. And a lot of this stuff has just come out in the last week or so. They truly have been trying to figure out how this is transmitted and what it means. And now, if you understand the science behind this, you start understanding why they are telling people to stay home and why they're segregating and why groups that are coming in and mixing, because each of us represents not only me, but everything I've been exposed to in the last 14 days. All right? Start thinking about the connections now between all of us. As that virus gets spread out more and more, that's a bigger deal. Okay? And again, we already know about transmissions at the CPAC. We're waiting to hear whether President Trump tests positive. But these things are important. Do not be a fomite, please. A fomite is something that is an inanimate object that provides a way of transmitting. And it's transmitted by you and I. I'm going to touch things. I'm going to have it on my hands. I'm going to walk across an area. Stuff that's dropped out has dropped onto the floor. I walk through. I step in it. I've got it on the bottoms of my shoes. Now I'm carrying it with me. I walk through the room where somebody had been, and those aerosolized particles are in the air. Guess what? I'm like this big thing that's just pulling the particles onto my clothes as I'm moving through. Right? Now you start seeing why the precautions that guy was using to protect himself are important. Head covering, right? Surface area is really high in your hair. There's a lot less surface area on a hat. Okay? And still, we'll have to deal with those things. We'll have to deal with the clothing, and we'll talk about that. Money. If you deal mostly in cash, my suggestion would be stop it temporarily. There's good reasons to deal in cash. However, the cash changes hands. All right, 80% of the cash in America, if they swab it, will test positive for cocaine. And all of it has viruses and bacteria. 100% of it, okay? People are sick, they're handling things, and again, it's that handling that ends up being the issue. All right, this is an unwashed hand, and if you look at it under UV light, those bacteria and the viruses show up. And that's what you're seeing there. 30 seconds of hand washing, and you have mostly a clean hand. So hand washing is going to be really important. I got a whole bunch of stuff up here, and we're going to talk about these. Let me see if we're going to talk about them now. Let's talk about the proper way to hand washing, and I want to correct this slide. Everybody's familiar with this, right? Gelled alcohol. Okay. Some things are very susceptible to alcohol, and some things are not. This year we have, if we weren't talking about the novel coronavirus, influenza A is very prevalent. Influenza A is not killed by hand sanitizer. You need more than 4 minutes of contact time, and nobody gets 4 minutes. You probably don't get the 2 that you're supposed to get for influenza B, which is sensitive. The coronavirus is similar to the influenza A. In both of those cases, just washing your hands for 20 seconds pretty much eliminates, if you have soap and water, pretty much eliminates the virus from your hands. Right? Hand washing is your friend for this virus. As much as they're telling everybody to do this, if you have nothing else available to use, do it, but otherwise wash your hands. Wear gloves, right? You can strip the gloves off. Now the virus goes into the trash with the gloves, and you don't have to worry about it. Okay? This is part of the reason for the protection. So lather, wash for 20 seconds. Make sure you get into the nooks and crannies. If you got rings, take them off temporarily. Don't leave them behind, as I have. Rinse, 10 seconds. And then number 5 says turn off the tap, and then it has you dry the hands. Well, you touch the tap with contaminated hands. Flip these two, please. Don't do this silliness. Dry your hands. Your hands were no longer contaminated. The towel's not contaminated. Now go through and wipe down the handle. Okay? That's a much wiser way to do this. So please flip those two in your mind, if you would, please. All right. Soap and water is our friend. I can wear very inexpensive protection clothing and take them off and put them into the washing machine, and it's done. It's dead. You don't have to worry about it anymore. Really, really simple. And the way that we typically look to do that, and I'll just show you real quickly, we do this quite a bit because, again, we deal with stuff that is infectious. All right, and for the moment, I'm going to put back on my gloves and my mask, and let me show you how we do this. All right, because really what you're trying to do is minimize your contamination. This is really important for anybody who's visiting anybody who's elderly who has health issues. All right, you want to make sure that you're protected. I'm going to put on the easy mask instead of the hard one. These masks are disposable, by the way. Beard is a no-no with these. You will not get a seat on this with the beard. And you have to adjust the nose pieces. So, been out shopping, getting stuff that I need, taking stuff to people who need it, and now it's time to disrobe in front of you. Wear 2 sets of clothes. This is how we do this day in and day out. Oh, wait. I'm getting ahead of myself. Foot bath. You can take a towel and a shallow trough, water, and chlorine. The amount of chlorine that you need is small. If you use too much, you will not kill anything. Really, really important. To a gallon of water, it's a half cup of bleach, no more. Okay? If you put more in, you're not helping yourself, you're actually making it kill less. Has to be diluted. If it's a half gallon, it's going to be a quarter cup. Okay? And so we would step into these things. Okay? And I would probably, in my case, if I'm worried about parvo, which I often am, I would leave those shoes in there. Let them soak. I would then start taking off this outer protective layer. And notice that I had clothes on underneath. Don't worry. I'm shy, you're shy, we're all going to be good. Okay, notice I haven't taken my gloves off yet, right? It's going to be one of the last things I do because I want to make sure that those gloves are the last thing that I take off. And I just toss it right in there. Okay, because I'm going to wash those later. Then I'm going to take off my clothes. Again, no worries. I'm a shy guy. But this is what you have to do to protect yourself. All of this can be disinfected and reused over and over and over again, and you haven't spent $100 and some dollars for that. Hat. Oh, look. Here's an idea. If it's not washable, you can spray it with Lysol, and that will help. Okay? And then you set it aside. But if it's washable, frankly, I don't really care that much about my hats. I just do that. By the way, it's also true for the socks, because if you get stuff on your socks, same sort of thing. If I walk into the house with that, I'm in trouble. And I'm still no better shot today than I was when I was a kid. Sorry, Mom. All right, so we're going to take off our glasses. Those can be washed in water. We're going to take off our mask. The masks are disposable. You can reuse them a little bit, but not too much. Okay, and at that point, I'm ready to take off. Wash my hands would be one of the first things that I would do. You can actually set up soap and water and rinse water right next to this so that before you go into the house, you're not tracking it with you. And by the way, just in case something got on my neck or something like that, if you truly have somebody at home that's at risk, the next thing to do is to go in and take a shower to make sure that anything, again, soap and water gets rid of that stuff. If you have somebody who's at high risk, we have a family member that has respiratory disease, and if she gets it, it's not going to go well. And so go in, take a shower, and you're done. And now you can resume your day, right? In your house. Disinfect your house periodically. But you're good to go. Okay? We do this day in and day out in our veterinary practices while we're dealing with infectious disease. It's not that hard, but you have to be careful about what you're doing to make sure that you do all the right things. All right. So that's the washing. You know about the bleach. Don't overdo the bleach. Soap and water is your biggest friend. Anything that can be cleaned with soap and water kills virus very quickly. Okay, disinfectants, everybody's buying these up from Costco. Great, but they're really expensive. Guess what? This is a heck of a lot less expensive. Things that can be washed, wash them. Okay? And reach for your hand sanitizer only if you have to. There's nothing else available. Okay, again, half cup of bleach to a gallon of water, quarter cup to a half gallon. Soap and water is much better than bleach. Okay, it actually works better, but both of these will do. And if the bleach is causing respiratory issues, you probably have diluted it. You haven't diluted it enough. Now, right now, we know the 1 to 32. I haven't seen anything published, but sometimes you can dilute this down again to 1 to 64, which would mean it would be a quarter cup to a gallon, but we don't know that yet. We do know that 1 to 32 works. All right, so if you have family members that are immunocompromised or you're immunocompromised yourself, your hair has to be contained. You should wear protective clothing. You should wear a face mask if you're having to go outside. Don't go outside unless you have to. Don't go mix in places unless you have to. Use services that will deliver that food to you. Believe me, if they're not already here in spades, they will be very shortly, right? Because that'll be a way that people can continue to work. The face mask, the protective eye covering to keep particles from hitting your eyeballs, right? It's mucous membranes, it's where you get it. The safety boots, the hand protection, washing your hands, foot bath would also be useful so that you can truly keep your home safe compared to the outside world, right? Wipe down your car and those sorts of things, right? 48 hours in the sun, you should be good. Remember, it only lasts for 42 hours. So if you can get past 42 hours, if you're not going to have to use your car for 2 days, you're good on the third day, right? It will have not been present anymore. All right, for the general population, these same things true still. Okay, however, life is about risk. You may decide that, well, I don't really want to do that. I'm just going to take my shoes off and not go through some of the other stuff. You will have to make those decisions. Whether or not you're going to wear stuff, or you're just going to walk into the laundry room, strip off your clothes, and drop them in there. Whether or not you're going to cover your head. I mean, these are all personal decisions people have to make, but they come with implications, especially if you're visiting other people, but also for yourself. And whether or not you're going to use a foot bath. But hand washing absolutely positively is a must. Face mask, you really should. And the other things you really should too. Right? The only thing that has been shown to prevent transmission is decreasing the exposure. And that means separating everybody and taking to make sure that they are not spreading the virus. All right, so we don't have to look like these guys, but really we still need to take precautions, and it's not that expensive. I literally went down to Goodwill and picked up an extra large shirt so that I could wear it over clothes, and it was like $5, right? If you order a suit online, you're talking probably 50, 60 bucks at this point. Everything else is through the roof. So there's a reason these people are all wearing the protective clothing that they do. Let's talk about masks real quick. The surgical mask is there to protect my patient from me. Right? Let's back that up. Who's wearing the surgical mask? The guy who has the illness, because they're trying to minimize the amount of particles going out into the room. These people that are trying to protect themselves are wearing these N95 and N100 masks, right? But this guy's just got a surgical mask on. All right, so these masks protect me from my patient, and that's good reason to. Dust mask do it. It has to be at least N95 or N100. They make these really cool fancy ones. My sister's ahead of the curve. She got one back in November. Because she's a germaphobe and always worries about the flu. So she was traveling with that in November when my brother had his stroke. Smart kid. Didn't get it from me. So when we look at, notice that the particle size for surgical masks is only 1 micron. The virus is small enough to go through the surgical mask, but not all of it does. Some of it will get trapped. So you're minimizing exposure, you're not eliminating exposure with a surgical mask. If you don't have a surgical mask, they've all been purchased, and the N95s are all gone, there are some things you can do. You can take a tea towel, not sure what I did with mine, and you fold it not once but twice and make it into something that will cover. It will actually give you the same protection, which is not that much, as a surgical mask. Right? 2 layers. Both of them are 97% effective, so they stop 97% of the particles that we're going through for the coronavirus. Okay, 97 is good. That's still 3% that's getting through. Okay, the downside of this, and one of the things that I did when I was at the University of Maryland, was I worked with a group that were working with respiratory masks, looking at our soldiers and the work of breathing. And it's 128% harder to breathe with 2 layers of towel than with one of these masks on, because those masks are designed to stop the particles but to let you breathe without maximizing your effort of breathing. The more stuff you put in front of your face to block stuff out, the harder it gets to breathe. Okay, and there's just no way around that. Who does that look like? Isn't that Tommy Lee Jones? All right, so this is from Australia. This is the artist rendition that was created by this woman who said that she was accosted by a man who was wearing this on his face and had a hat on. I swear that's Tommy Lee Jones. But these do help compared to nothing. Again, food handling gloves is all you need. You don't have to get the special surgical gloves. These are like less than a penny a piece. Really, really cheap. You can get boxes of them, right? And they don't have to be super big. Super big falls off, I'll just warn you. They tend to fall off your hand if they're too big. If they're too small, you feel like you're sweaty. There's got to be a medium size in there that works. Head covering. This should look familiar to most of us. We have what the president wears, and we have what the leader of the house wears. And it really doesn't matter what kind of head covering you put on, as long as again, the goal is to decrease your surface area on your head. Okay, foot baths at home. Again, it doesn't have to be real deep, and you just rock in that bleach solution. Needs to be changed every 24 hours because it gets deactivated by sunlight. That's why bleach is in something that light doesn't pass through. If it's in the sun, it's deactivated. Make sure your shoes don't have holes in them, because otherwise the comes in on your feet, which is not that much fun. Okay. Eye protection. Again, all you're trying to do is just keep particles from hitting your eyes. All right, and you may need to put stuff in there to keep them from fogging.
Glasses don't work.
Glasses will work. You know, if you want to wear glasses, just remember any space that stuff can pass around is space that things can get in. That's why the guy had cut the bottom of the tube, and now his face was fully protected. He didn't have to worry about any of that stuff getting in his eyes. Women have it easy, right? You saw what I did to get out of my jeans. Long skirts that go all the way down to the ground are perfect for this, and they're really easy to get off. Likewise, just a long sleeve shirt. Again, you can wear clothes underneath that, shorts underneath that, really easy on and off. Keep those things. You come out of the house, you put on what you're putting on to go out and do your stuff. Don up, and when you get back, go through the process of stripping it all off. So, face masks, cover your hair. Shoes for leaving the home, don't use those shoes inside the house. Washable cover overclothes. Hand sanitizer is not preferred. Hand washing is the best way to deal with this. Food handling gloves for shopping. Now you don't have to worry who else has walked through there in the last 3 hours or been there in the last 48. Or whether they coughed on something as they were walking by that they never even picked up, right? And wipe those things down when you get home. You can take a dilute bleach solution and go through and clean everything up, and you're good. Are things that disinfect vegetables. Vinegar does not do it, as much as you may see on the internet that it does. Bleach solution will. Clear glasses or goggles, or who knows, water bottles. If it comes to push comes to shove. At home, remove your mask, spray it with Lysol if you're going to reuse it. Remove the hair covering, either or spray it with Lysol. Foot baths, remove, wipe down the tops with the remove your clothes, put them in the clothes hamper, wash those clothes. You can reuse them. You don't have to worry about it. It's dead. Okay, hand washing. Before you enter into the rest of the house, keep your clothes that you use in the house separate from the clothes that you use to go out in the world. Okay, this is biosecurity at home. Shower and relax. Maybe the hardest part. Okay. Effective personal protection habits. Card, no cash. Why? Because you can wipe those down really easy. But whatever's on the cash, you're going to get it. Avoid crowds and high foot traffic areas. Look to use some of these services that will deliver things, right? It's a really inexpensive way to avoid something that's really bad. Still have to go through the decontamination process for what you bring in. There are no innocent contacts with people. You're living vicariously before they get sick for 14 days with everybody they've come in contact to, and for 37 days after they've stopped being sick, if they're not staying home. Objects, pets, this is the question that was asked earlier. It does transmit, but doesn't cause disease so far in dogs. Cats also have their variant. The last version of the SARS virus was showed in cats. And at this point, they don't know. So the safest thing to do is avoid contact with them. Wave, smile, no handshakes. Don't be a fomite. Think before you touch things, and for jeepers, none of this stuff. No picking your nose, no touching your mouth. If you're going to eat, wash your hands and then prepare your food. And then after you eat, wash your hands again, right? The more hand washing you do, the less likely anything's going to be there. Soap and water is your best friend in all this because it kills a virus in 20 seconds. You need probably in excess of 4 minutes with hand sanitizer. You're just not going to get it, all right? That's all you got. Do it. Change clothes and shower upon arrival home. All right, questions? We'll start here.
How about with cell phones? Everybody is touching the cell phone.
Yep, so we need to disinfect the cell phones. I'm still, UV light, there's a number of different products that use UV light to disinfect cell phones and other things. We don't know at this point that it hasn't been done and proved that it's effective. It kills all these other coronaviruses very quickly. And so the expectation is that you have the right wavelength, and that's UVC, not UVA, not UVB, UVC, which is down further in the spectrum. And it should kill, but I wouldn't pull the trigger on that until they actually say it does kill. That work needs to be done. Okay. But wiping those things down, anything, if you have a protective case, mine's broken, but my wife still has hers in her Otter case, that's submersible. You can soap and water that all you want and then bring it back out and your cell phone's just fine. And that would be appropriate to have your cell phone in something you can clean. And I got one in front of you. Yes?
Does it help to get the flu shot or not?
Could you repeat it?
Completely. The question is, does it help to get the flu shot or not? I'm a horrible person to talk to you about that. That's a longer conversation with a lot of other issues. I think I'll just defer that. The flu shot will help you in no form or fashion for the coronavirus. No way. It just completely, it's not influenza, it's corona. Different viruses. It will absolutely positively for the coronavirus won't help you in any form or fashion. Okay. I think we had
I
Ronald.
wanted to let you know that those boot bends, you put your boots and all in,
Uh-huh.
you can get them at Walmart in the automotive section.
Okay. Yeah, and those things are just really effective to get that stuff off your feet, right? He was noting that at Walmart they have bins that are actually designed for immersing your boots in. But the biohazard, like when we go to pig farms and have other places that we have a lot of issues, not only do we have that, but we're scrubbing stuff. We clean it and then we disinfect it, and it's a multi-step process when you're dealing with things that could kill millions of pigs or millions of birds. Robert?
Yeah, any idea with this coronavirus with bio and genetically engineered?
I wouldn't know.
How that?
Yeah, I wouldn't know. The Chinese the Chinese, Russians, and Iranians are claiming that the United States launched an attack on them, snuck into their country, brought this coronavirus, planted it in Wuhan, China, and that we have unleashed this on the world. I would just say that in general, if you look at the Democrats as a model, anything that somebody else is accusing you of is usually what they've done. But we don't know. We have no ideas as to where it came from, other than it has genetic components of both bats and snakes. And the question becomes, why does it have both of those? And there might be some reasonable reasons for that. There may not. Judy, and then I'll come back.
Yes, what if you feel that you have any of these symptoms? Do you just go to the
Nope.
emergency room?
Nope.
What do you do?
So the first thing that you do, and things on that are going to change. Everybody needs to keep in touch with how things are changing. President Trump has declared an emergency. They're mobilizing resources to create testing. You'll probably have some place that you can do a drive-by testing. That stuff is coming. Things are changing from the get-go. However, what won't change is if you think you have symptoms that could be consistent with this, you need to call the healthcare providers and talk to them, tell them that you're fearful, tell them what your symptoms are, and they will tell you what it is that they need you to do and how you need to dress, and whether they're going to meet you in the parking lot with a mask if you don't have one, or what they're going to do to protect their other patients. And there will be sections that are set up specifically to deal with corona and unlikely corona cases. Okay? All of that's going to be in flux until all the things are in place to actually deal with those things. I got one, yes, ma'am.
Can they start handing out the contact information?
Yep.
forms?
So we have contact information forms for everybody. We're having a leadership meeting today. We're going to be discussing the various issues and how we are supposed to best respond to that, okay? We know that the ONEG that we're having today, we are going to be serving you. Do not pick up anything. We will hand you your plate. You tell us what it is you want, and we will make sure that there's no transmissions between people and the food is safe to eat. This will be the last ONEG for a while. I got one in front. Nope. I had one more, and then I'll come back to you, Stacy. Yes, ma'am.
I want to say something about, you know, that I was a caregiver for children, and I learned that I changed their sheets and their bedspreads, everything,
Yeah.
every day, and the children would get well right away.
Yep,
Get rid of your virus, because when you sleep, you're
breathing out. It's in your
all the
pillows.
bacteria back into your body.
Yep.
So that's a must wash your sheets, pillowcases
Yep.
every day.
Anything and everything that can be washed in soap and water, you do not need to add bleach to your laundry, is good. Really important. You will have clothes that's colored, and you will see color-safe bleach. It is not bleach. It does not kill anything. It's hydrogen peroxide. It will not kill this virus. Okay? So don't be sucked into color-safe bleach. It's truly got to be hypochlorite. Okay? Don't get confused by that. Okay? Other questions? Yeah, Stacy?
The question I have is, why do they think that the epicenter is in Europe instead of in China? Why-
Oh, because the epicenter has shifted, and that's probably a longer answer. There's real questions about exactly where the epicenters are. There's a number of different governments that are just not fessing up with their cases. China was one of them. Iran is one of them. Russia is one of them. And the people who are reporting correctly what they're dealing with are in Europe. And so it appears to have shifted because it's waning in China. And how did they get it to wane? They literally said, you have to stay home. They shut down their factories, they shut down their businesses, and they said, you just don't mix, because that was the only way to keep the virus from continuing to explode out. Okay, and that's what we're in process of ramping up on. That is the only way that has been shown to prevent transmission of the virus in populations. Okay, until they come up with a vaccine or something. I have one more and then I'll come back to you. Yes, ma'am.
We've been hearing a lot that it's a winter virus.
Yeah, so the whole idea that something is a cold is because they tend to transmit more in colder months. That's where the nomenclature comes from. And so the rhinoviruses, the coronaviruses that are the typical cold viruses, that's why they're called colds, because it happens during the winter months. They don't happen generally. It's a different set of viruses that cause summer colds. Okay? Yes?
How true is it that Israel has already developed a vaccine?
Yeah, that kind of stuff comes out, but you haven't seen them. Israel has never been shy about releasing things that the world needs to the world as soon as they have it in place. I would just say that there was a comment about something else that came through medical-wise about 2.5, 3 years ago, and it showed up in the paper and then there was nothing. And I would say this is the same thing. Everybody's working on a vaccine, but it's really hard. Are there any vaccines for the common cold currently? Zero. Okay.
Everything that's going on, are we still gonna have Passover?
We will talk about that
We-
today in the leadership.
Yep, we're going to make some decisions on a number of different things. We are likely to be changing how we do some things. But we will get together with the leadership. We're going to make those decisions. And then part of the reason that we're getting everybody's contact number, it's really, 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 really important that you fill that out and get it back to us today, is so that we can let you know what we're doing and what we're not doing and what things are changing. Okay, that'll be really important. Yes.
I hear a doctor telling that people should not drink cold drinks, it's right, or?
I don't know what the mechanism of that is. It
That virus, it's like with the cold, with
the virus enters not through the respiratory tract. I'm sorry, not through the GI tract, but through the respiratory tract. I'm not sure how drinking cold anything is going to help you. You can't kill it easily. Oh, avoid it. Yeah, I don't know what the mechanism for that would be. Judy?
Does anybody get a form? Does anybody need a pen to fill out the form? But when you're done
Good eye.
through the offering, put your forms and the pens that you borrowed into the offering,
And,
okay?
and Judy, hang on a second. I think my wife had her hand up at some moment, so let me. No? She's. No comments? No, all right. Judy?
Yes, Rusty, is there anything that we could do ourselves, like, I mean, not vitamin supplements or things like that, to keep ourselves, our immune system up? Like, they sell vitamin C emergency and things like
Yeah,
that.
and the more they look into those things, they're not harmful, but most of them are not showing to be as helpful as some of the initial studies had shown. And there's no information regarding the coronavirus, the novel coronavirus specifically. But in general, the general comment about that is those things are not panning out to be as helpful as everybody thinks they are. You know, remember the placebo effect, the feeling that I'm going to be protected by something is important. Remember that prayer, the effects of prayer are much higher than the placebo effect. Okay, that's really important to remember. All right, we have one who we can depend upon in all this. That doesn't mean that we take silly chances, but we should do what we're supposed to do, and we should be in prayer. Hang on just a second.
You said that this originates from bats and serpents.
There's bat genetics in it, there's serpent genetic in it.
So if the Bible says that like problems kind of started with a serpent, and then like Noah thing, like a black bird flying out there thingy, is there like a spiritual connection with this?
I don't know. Yeah, I think maybe time will tell. There's a lot of questions about this virus, and you know, I don't know. I haven't thought about it from that standpoint. So, but you know, it's never bad to think about things spiritually and what they can mean. Yes.
The main thing is to keep yourself clean and your surrounding as disinfected as much as possible to not continue to further worry about the
Yep.
airborne or whatever.
So let me put it to you this way. The question is it important to keep your environment that you're in clean and to disinfect it? So every single time that you go out of your home, you need to protect yourself at whatever level you decide you want to do. And when you come back, before you go in, you need to disinfect yourself. All right? Your home, if you are not bringing stuff in, your home, you should clean it maybe twice a week, right, to disinfect things. I mean, I do my countertops more than that. I do that on a daily basis. I'm preparing food. All of those things are appropriate. Hand washing, all the stuff in your home can still go on just like it always has. But when you go out, put on your protective gear, think about what you're doing, think about what you're touching, what you're not touching, right? And then when you get back, now you need to go through that process of disinfecting. Yes.
My daughter would like me to ask.
Uh-huh.
If you take a test for the flu
Uh-huh.
and you're positive for that,
Okay.
no, you're not positive.
Okay, I heard this at school, somebody
Okay.
that if you, it's easier to take a test for the flu, and then if you test positive for the flu, you don't have the coronavirus.
Not necessarily true. You could have two things simultaneously. If your immune system is already dropping, you can easily get something else. Those infections happen. But in general, we like to think that if somebody's sick, they're sick for one reason. But there are times we do see it where it's multiple things. But I wouldn't just make those assumptions. Again, with as much potential for picking things up, I mean, with the flu, you should be home. You know, if somebody tests positive for it. So, but okay. Yes, Judy, and that'll be the last question because I've taken up way too much time.
They say it started in Wuhan, China. Was it because people were eating those animals, like the snakes were eating the bats and
That-
people were eating the snakes, or what?
That was the original story the Chinese gave us. Now they're saying that and my picture is Tom Cruise coming over on a Mission Impossible trip and dispersing it into the population over there. That they literally are claiming that this was a virus that was planted by the United States, that we infiltrated in and planted it.
But it's because of the things that they eat, though. They eat things that we would never think of eating.
Yeah, certainly could be. Absolutely. We just don't know. So, all right. Thank you very much. I'm sorry that probably ran a little longer than I meant it to, but